1. Which of the following is not a basic component of community health? A. Disease prevention, B. Preservation of good health, C. Treatment of major diseases, D. Promotion of good health. Answer is C. Treatment of major diseases. Alright, let's think about what community health really focuses on. It primarily deals with preventing diseases, promoting good health, and preserving the well-being of the community. While treating major diseases is crucial, it's more of a healthcare service focus rather than a basic community health component. So, the correct answer is C, treatment of major diseases. 2. The core factor used to overcome political differences in community participation is A. Proper accountability, B. Selecting good leaders, C. Teamwork, D. Transparency. Answer is D. Transparency. I hope you got that one, ha ha ha, although dealing with political differences can be tricky. The key here is transparency. Being open and clear about actions and decisions helps build trust and fosters cooperation. While accountability, good leaders, and teamwork are all important, transparency stands out as the core factor in bridging political divides. So, the correct answer is D, transparency. 3. The first step to consider when planning any communication to the community is A. Prepare the message, B. Identify the audience, C. Develop goals, D. Select channel of communication. Answer is C. Develop goals. I hope you did not choose option B, he. Let's think about this logically. When you're planning communication, the very first thing you need to do is understand what you're trying to achieve. This means developing clear goals. Once you have your goals set, you can then identify who your audience is, prepare your message accordingly, and finally decide the best channels to use. So, the correct answer is C, develop goals because it gives you the direction for all subsequent steps. 4. The best way of making a community diagnosis is by A. Looking for existing medical records, B. Talking to village leaders, C. Attending community gatherings, D. Carrying out home visits. Answer, D. Carrying out home visits. Now, let's think about this practically. To really understand the health needs of a community, you need to see things firsthand. Carrying out home visits allows health workers to get a detailed view of living conditions and health issues that might not be obvious from records or meetings. This hands-on approach is the best way to gather accurate information. So, the correct answer is D, carry out home visits. 5. Which of the following is not a step in planning for PHC activities? A. Setting objectives, B. Identifying activities, C. Developing supervision schedule, D. Spelling out evaluation strategies. Answer is C. Developing supervision schedule. Planning for primary health care, PHC, activities involve setting clear objectives, identifying the necessary activities, and defining evaluation strategies to measure success. While supervision schedules are important for implementation, they aren't typically part of the initial planning steps. So, the correct answer is C, developing supervision schedule. 6. Which of the following is not considered under the school health program? A. Safe water supply, B. Personal hygiene, C. School policy formulation, D. Pit latrine construction. Answer is C. School policy formulation. Let's explain. School health programs focus on providing safe water, promoting personal hygiene, and sometimes even constructing sanitation facilities like pit latrines to ensure a healthy environment for students. School policy formulation, however, is more about governance and administration, not a direct component of the health program itself. So, the correct answer is C, school policy formulation. 7. The appropriate measure that a nurse should apply in managing a disease outbreak in the community is to A. Mobilize and sensitize the community, B. Distribute health resources equitably, C. Provide feedback to the community, D. Provide income generating activities. Answer is A. Mobilize and sensitize the community. In the face of a disease outbreak, the first step is to mobilize and educate the community. This ensures everyone knows the risks and the preventive measures they need to take. Equitable resource distribution and feedback are important too, but they come after community mobilization. Income generating activities, while beneficial, aren't directly related to outbreak management. So, the correct answer is A. Mobilize and sensitize the community. 8. The primary goal of the rehabilitative healthcare system is to A. Cure the disease by use of drugs, B. Help clients live with chronic diseases and disability, C. Provide appropriate referral to the community, D. Carry out corrective surgery. Answer is B, because rehabilitative healthcare is all about supporting individuals to manage and live well with chronic conditions and disabilities. It's not primarily focused on curing diseases or surgery, but on enhancing quality of life through continuous care and support. So, the correct answer is B, help clients live with chronic diseases and disability. 9. The primary role of community leaders in their localities is to A. Provide support supervision to village health teams, B. Mobilize community for health programs, C. Mobilize local partners to support village health teams, D. Follow up on wrongdoers in the community. Answer is B. Mobilize community for health programs. Community leaders play an important role in rallying the community for health initiatives. While they may also support village health teams and mobilize partners, their primary role is to engage and motivate the community to participate in health programs. Following up on wrongdoers is more about community discipline. So, the correct answer is B, mobilize community for health programs. 10. The process of enabling people to increase control over the determinants of health and thereby improve their own health is A. Health protection, B. Health prevention, C. Health promotion, D. Health education. Answer is C. Health promotion. Because, health promotion is all about empowering people to take control of their health determinants and make positive changes. It's broader than just protection or prevention and encompasses education too. It's about fostering a supportive environment for healthy choices. So, the correct answer is C, health promotion. 11. Nurses should assess the health status of a given population at a particular time through A. Community mobilization, B. Community participation, C. Community entry, D. Community diagnosis. Answer, D. Community diagnosis. Alright, let's get into this. Nurses use community diagnosis to assess the health status of a population. This involves systematically gathering and analyzing data to identify health issues and needs. Options A and B are important for engaging the community, but they don't specifically refer to assessment of health status. Option C, community entry, is about starting work in a new community. So, the correct answer is D, community diagnosis, because it directly relates to assessing health status. 12. Which of the following is referred to as a collection of people identified by a set of shared values? A. Community-based home, B. Community, C. Family, D. Communal village. Answer is B. Community. Let's break it down. A community is a group of people who share common values, norms, and a sense of belonging. This shared identity helps in collective decision-making and support. Option A, community-based home is a specific type of living arrangement, C, family is a smaller, close-knit unit, and D, communal village is a type of community but more specific. So, the correct answer is B, community, because it broadly encompasses a group with shared values. 13. Which of the following is not a condition for the effectiveness of community health services? A, accessibility, B, availability, C, utilization, D, equity. Answer is D, equity, and here's the deal. For community health services to be effective, they must be accessible, A, and available, B, to the population. Utilization, C, is about how these services are used. However, equity, D, while very important, is a broader principle ensuring fair access rather than a direct condition for effectiveness. Therefore, the correct answer is D, equity. 14. The type of survey that involves examining and questioning a sample of the population in the community at one point in time is termed as A, cross-sectional survey, B, longitudinal survey, C, horizontal survey, D, explorative survey. Answer is A, cross-sectional survey. Wondering why? I get you. A cross-sectional survey involves examining a sample of the population at one specific point in time, providing a snapshot of their characteristics or health status. A longitudinal survey, B, tracks the same population over a longer period. Horizontal survey, C, isn't a standard term here, and explorative survey, D, is more about initial investigations. So, the correct answer is A, cross-sectional survey. 15. Which of the following is a method of community mobilization? A, guidance and counseling, B, good leadership, C, political commitment, D, home visiting. Answer is D, home visiting. Let's think about this. Home visiting is a direct method of engaging and mobilizing the community by meeting them where they live. It builds trust and facilitates the spread of health information and services. Options A, B, and C are essential for support but aren't direct methods. So, the correct answer is D, home visiting. 16. The Sustainable Development Goal builds on the principle called A, holistic approach, B, health for all, C, gender inequality, D, leaving no one behind. Answer is D, leaving no one behind. The Sustainable Development Goals aim to ensure that everyone, especially the most vulnerable, benefits from progress. This principle is called leaving no one behind. Options A, holistic approach, and B, health for all are related concepts, but not the foundational principle. Option C, gender inequality is an issue these goals aim to address. So, the correct answer is D, leaving no one behind. 17. Which of the following explains the meaning of appropriate technology in PHC? A, drawing up joint plans, B, improving local capacity, C, improving community mobilization, D, improving development projects. Answer, B, improving local capacity. Appropriate technology in primary health care, PHC, means using methods and tools that fit the local context, improving the community's ability to sustain these practices. Options A, C, and D are important but not the specific meaning of appropriate technology. So, the correct answer is B, improving local capacity. 18. The major aim of health education in primary health care activities is to A, provide appropriate care to the community, B, make a health plan for the future, C, improve the health of the community, D, meet the needs of the community. Answer is C, Improve the health of the community. Let's get this clear. The main aim of health education in PhD is to improve the overall health of the community by empowering individuals with knowledge and skills. A, B, and D are part of this process, but the ultimate goal is improving health. So, the correct answer is C, improve the health of the community. 19. The step of action where members identify their health needs, prioritize, and plan their health activities is community. A. Organization, B. Participation, C. Mobilization, D. Dialogue. Answer is B. Participation. Alright, let's clarify this. Community participation involves members actively identifying their health needs, prioritizing them, and planning appropriate activities. This participatory approach ensures that health interventions are relevant and supported by the community, leading to better outcomes. So, the correct answer is B, participation. 20. An approach that stimulates the community to initiate and maintain the running of the health activities at its own cost is called A. Self-reliance, B. Sustainability, C. Dependence, D. Appropriate technology. Answer is A. Self-reliance. Explanation: self-reliance empowers communities to take charge of their health activities, ensuring long-term sustainability. It encourages local initiative and resource management, reducing dependence on external aid. So, the correct answer is A, self-reliance. 21. The disease that is present the whole time in the community and occurs all year round is referred to as A. Whole endemic, B. Whole epidemic, C. Hypoendemic, D. Hyperendemic. Answer: A. Whole endemic. A whole endemic disease is consistently present at high levels in a community throughout the year, particularly affecting young age groups. Hyperendemic, D, indicates high prevalence but doesn't specify age groups. Whole epidemic, B, and hypoendemic, C, are less commonly used terms. So, the correct answer is A, whole endemic. 22. In community health, school children are the main focal persons for A. Performing community health talks, B. Effective dissemination of health messages, C. Delivery of organizational instructions, D. Encouraging community leaders to take part. Answer: B. Effective dissemination of health messages. School children are excellent at spreading health messages effectively due to their ability to learn quickly and share information with peers and family. They are not typically responsible for performing health talks, A. Delivering instructions, C. Or encouraging leaders, D. Although they can influence these areas indirectly. So, the correct answer is B. Effective dissemination of health messages. 23. A situation where a number of people in a given population develop a disease during a specific period of time is termed as A. Prevalence, B. Incidence, C. Outbreak, D. Epidemic. Answer: B. Incidence. Incidence refers to the number of new cases of a disease occurring in a specified population during a specific time period. Prevalence, A, measures the total number of cases at a given time, while an outbreak, C, and epidemic, D, indicate a higher than normal occurrence of a disease. So, the correct answer is B, incidence. 24. When the symptoms of a disease start, the affected person becomes sick, and this is referred to as A. Clinical stage, B. Susceptible stage, C. Subclinical, D. Disability stage. Answer is A. Clinical stage. The clinical stage is when symptoms of a disease become apparent, and the person is visibly sick. The susceptible stage, B, precedes disease onset, the subclinical stage, C, involves asymptomatic infection, and the disability stage, D, follows when the disease causes significant impairment. So, the correct answer is A, clinical stage. 25. The primary goal of the rehabilitative healthcare delivery system is to A, help clients to live with chronic diseases and disability, B, carry out corrective surgery, C, provide appropriate referral to the community, D, cure disease by use of drugs. Answer is A. Help clients to live with chronic diseases and disability. The main aim of rehabilitative healthcare is to help clients manage and live with chronic diseases and disabilities, improving their quality of life. This involves ongoing support and therapy, rather than curing diseases with drugs, D, or corrective surgery, B. So, the correct answer is A, help clients to live with chronic diseases and disability. 26. Which of the following is not a priority population of high-risk groups in primary health care services? A, women, B, children, C, men, D, the vulnerable. Answer is C. Men? Alright, let's break this down. When we talk about high-risk groups in primary health care, we're focusing on those who generally need more attention due to their vulnerability. Women and children often fall into this category, as do other vulnerable populations. Men, while important, aren't typically classified as a high-risk group in the same broad sense. So, the correct answer is C, men. 27. A nurse who assesses whether resources are maximized in the implementation of a primary healthcare program is evaluating the program's A, effectiveness, B, efficiency, C, impact, D, outcomes. Answer is B, efficiency. Alright, let's first define what we're looking at here. Efficiency is all about how well resources are used to achieve the best possible results. If a nurse is checking whether resources are being maximized, they're focused on making sure everything is used as effectively as possible. Effectiveness, impact, and outcomes are important too, but they come later. So, the correct answer is B, efficiency. 29. The following diseases are associated with improper food hygiene except A, cholera, polio, and typhoid, B, food poisoning and intestinal worms, C, diabetes mellitus and tetanus, D, diarrhea and food poisoning. Answer, C, diabetes mellitus and tetanus. Alright, let's break this down. Improper food hygiene can lead to diseases like cholera, typhoid, and food poisoning, which are spread through contaminated food and water. However, diabetes mellitus and tetanus aren't typically associated with food hygiene issues. So, the correct answer is C, diabetes mellitus and tetanus. 30. The following are methods of monitoring except A, visiting, B, meetings, C, supervision, D, complaints. Answer is D. Complaints. Monitoring methods include visiting, holding meetings, and conducting supervision to ensure everything is on track. Complaints, while helpful, are more reactive than proactive monitoring methods. So, the correct answer is D, complaints. Now, let's tackle 10 fill-in type of questions. Are you ready? Say yes, we continue. Hey, enough with the jokes. Number 31. A participation where 2 or more ministries agree towards achievement of a common goal is. Answer is intersectoral or multi-sectoral collaboration. Alright, imagine 2 or more government departments sitting down together, agreeing on a big goal they all want to achieve, like improving healthcare or education. That's what we call intersectoral or multi-sectoral collaboration. It's like different teams joining forces to tackle a big project together. 32. The transfer of authority for planning and management decisions from the central government ministries to lower community level is termed as. Answer is decentralization. Decentralization is when decision-making power moves from big central government offices down to smaller local community levels. It's like giving more control to the people who actually live and work in those communities, so they can make decisions that affect their own lives. 33. The process of bringing people together to participate in PHC activities is referred to as. Answer is community mobilization. Alright, picture this. You're trying to get everyone in a community involved in activities like health checkups or vaccinations. So, you go out and talk to people, get them excited, and get them to join in. That's what we call community mobilization, bringing everyone together to take part in these important health activities. 34. The key component of primary prevention is. Answer is health education. Let's keep it simple. Primary prevention is all about stopping health problems before they even start. And one of the best ways to do that is by educating people, teaching them about healthy habits, like eating well and exercising, so they can avoid getting sick in the first place. 35. Dash refers to the study of distribution and determinants of disease and injuries in human population. Answer is epidemiology. Alright, let's unpack this. Epidemiology is like being a health detective. It's all about studying how diseases and injuries spread through different populations and figuring out why they happen. By understanding these patterns, we can work out how to prevent and control them better. 36. The bottom-top approach, which enables people to utilize the available resources in order to improve on the quality of care, is known as. Answer is community-based health care. Now, let's break this down. Imagine starting at the very bottom, with the people in a community. CBHC is all about getting those guys involved in their own healthcare. It's like saying, hey, you know your community best. Let's work together to make sure everyone gets the care they need, using the resources we have. 37. Wastewater containing solid and liquid excreta from homes in a community is referred to as. Answer is domestic sewage. Alright, let's simplify this. Domestic sewage is basically all the dirty water and waste that comes out of our homes, like from toilets, sinks, and showers. It's important to manage this properly to keep our communities clean and healthy. 38. The component of community health that promotes the well-being of a child and her education is. Answer: school health. School health is all about making sure kids stay healthy and safe while they're at school. It's not just about treating them when they're sick, but also promoting things like good nutrition, physical activity, and mental health so they can learn and grow. 39. The PHC concept that emphasizes bringing services closer to the people is. Answer: accessibility. Now, let's make this clear. Accessibility is all about making sure healthcare services are easy for everyone to get to, like having clinics, medical centers and pharmacies right in the neighborhood, so people don't have to travel far to get care. It's about making healthcare convenient and available for everyone. 40. The third Sustainable Development Goal is. Answer: good health and well-being. Of course, the third Sustainable Development Goal is all about making sure everyone, everywhere, has access to good health care and lives healthy lives. It's like saying, hey, let's work together to make sure everyone's healthy and happy, because that's the foundation for a better world. If you find these videos helpful, please subscribe, please.